The purpose of this video is to show you how to use the Zoll. As we know, statistics have shown that early defibrillation saves lives, so we do not want to have any delays of getting the Zoll to the bedside and placing the pads and seeing if a shock is advised. That is the function of any BLS nurse, and so I'm going to show you how that's done. So primary RN determines that her patient has a cardiac arrest. She's going to push the code blue button, and then she's going to call for help, and the first responder is going to grab the crash card and bring it and place it outside the room and take the Zoll into the room, place it on the bedside table. The pads are going to be placed onto the patient. One goes on the chest and one goes on the back. You're going to place the backboard underneath the table, and it's really important that you make sure that these cables are connected. It will not work if it's not connected, and that will cause a delay when you're trying to figure that out. So make sure you connect that. Then you're going to go to the Zoll and you're going to put it in defibrillation mode, and you're going to wait, and it's going to give you the heart rate of the patient. And it's going to, so you're going to want to know if it's a shockable rhythm. Because we're BLS trained nurses, the only way we're going to know is to phone a friend, and we're going to want to analyze. So we're going to press analyze right here.
Stand clear.
So it's going to tell us if a shock is advised. We're going to stand clear, everybody clear. Remember,
No shock advised.
so no
Perform
shock
CPR.
advised, and then you'll go back to performing compressions. It's really important that when they're saying stand clear, is that you're stopping your compressions, you're removing bagging and masking, and nothing is touching the patient. So now we go into a different rhythm, and when we go into the different rhythm, we're going to phone a friend to analyze this rhythm and tell us if a shock is advised.
Stand clear.
And so once again, we're going to stand clear, everybody clear, stop compressions, take oxygen, or stop bagging.
Press shock.
And then we're going to press the shock buttons because it's telling us the shock is advised. We press the shock,
Perform CPR.
and then we go immediately back to our compressions. And so that's how you use the Zoll monitor. If you have any questions, please reach out with your questions to Lori Olvera.